Morning, everyone. Let's see here. We'll get started in just a second and get kind of tech issues out of the way here. Morning, everyone. We'll get started in just a second, guys. We're going to give some time to for people to hop on. While you guys are waiting, the worksheet that I sent out to you guys, if you guys can pull that up, that would be awesome. So we have that ready to go. And I'll kind of be going over some of the equipment you guys might need. Pretty much there's pretty minimal. If you guys have a yoga mat, that would be great. If not, that's okay too. If you have a foam roller, that'd be awesome to grab. If not, we're gonna make modifications as well. Can you guys hear me okay? If you guys can hear me okay, let me know. I think you guys should be able to go in the comments or in the chat. Awesome, thanks, Stephanie. Glad you guys are able to hear me okay. All right, we're gonna give about 1 or 2 more minutes. Again, if you guys are just joining on, go and grab your guys' worksheets. Okay, guys. So I think we're gonna go ahead and we're gonna get started. So what I'm gonna do is I'm actually gonna share my screen with you guys. Let's see. All right. Perfect. All right, I'm gonna make this. There we go. All right, can you guys see my screen okay? You guys should be able to see the. All right, perfect. Awesome, good, perfect. Glad that's working out well. All right, guys. So we'll go ahead and we'll get started. So if you guys are here to learn about how to run pain-free, or if you're dealing with injuries and you've kind of been taking some time off and trying to get back into it, or you've just been dealing with chronic injuries over the years and you want to figure out how to fix it, you're in the right spot. So part of me, I'm going to be kind of looking off screen here because I got my notes from the slides and then the slides here as well. So main thing is, for those that don't know me, my name is Ben. I'm a physical therapist. I'm also a certified strength and conditioning specialist. I'm passionate about this topic because myself, I'm a runner too. And before I became a physical therapist, I had a lot of people tell me that you should just stop running because I was having some knee issues. And I took some time off and went to physical therapy and went to chiropractors, acupuncturists, and whatnot too. And I kept going. And then I also went back to my physician and it just didn't seem to be getting better. And they told me, well, maybe you should stop running or decrease how much you're running. And that was a tough pill to swallow. And then when I got into physical therapy school and began to learn more about the human body, I realized that this was bad advice. Like there's ways to get around this and to allow people that want to run to be able to run. Just got to be able to have enough time with patients and be able to get to the root issue and find it. And that's what we specialize in here. Okay. So you guys, I want you guys to pull up the worksheets that I handed out to you. I'm going to pull those up as well. So what I want you guys to do is I want you to write in your worksheet what's the number one thing that you guys want to learn today. And then I also want you guys to type that in the chat. All right. So we got a smaller group today, which is awesome because then I can tailor it to you guys and what you guys will find most benefit for this workshop. Okay, so I want you guys to go ahead and write that down, and then also go ahead and type that in the chat as well. Okay, I'm gonna move this so I can see the chat here. All right, so the main thing is I want this to be interactive. I want you guys to get the most out of this as you possibly can. And what's gonna help with that the most is by being active in these comments and kind of filling me in on what's going on, all right? So you guys can also see in the worksheet, I want you guys to also let me know, like, how long have you been dealing with this injury? I also want you guys to write that down. Has it been a week? Has it been a month? Since COVID hit, we've seen a huge uptick in running injuries because so many people were going to the gym, but then the gym's closed and now they're starting to run again. And so we're seeing a huge uptick in knee injuries as well as ankle injuries and a little bit of hip injuries as well with regards to runners, okay? And that's the reason I decided to do this workshop today is because there's such a need for it. There's so many people out there dealing with knee injuries and are struggling with that. So I also want you guys to think, what does this injury hold you back from doing? You know, I know this is a running workshop, but most likely if somebody's dealing with having knee pain with running, they're also having knee pain with other things as well. You know, it can be going up and down stairs. It can be squatting. It can be sometimes, a lot of times runners just don't just run. They do a lot of strength training as well. So sometimes people have pain with lunges, pain with squats, pain with stuff like that. So I also want you guys to think about what other ways is this impacting your everyday life and then also your ability to be active as well. And I also want you to think about, you know, where are you now and where do you want to be? Okay, where's that gap? Okay. And then lastly, I want you guys to kind of identify your why. What I mean by this is, I usually ask this question too, is like when before a patient comes in for an evaluation, I always sit down on the phone with them and discuss, you know, what are your goals and what would successful physical therapy look like? And they're always like, they always tell me the same thing. Oh, well, I'd just like to get out of pain. I'm like, that's great. We can definitely do that. But what's your why? You know, we want to turn this into more functional stuff. So for example, I had this phone call with a patient that actually came in this week. That's a runner. And I asked them, what are your goals? And they gave me that answer. I want to become pain-free. And I'm like, great. Okay. Let's dive a little more deeper into that. And they're like, I'm like, well, what if you were pain-free, what would you be doing? They're like, I'd be running more. And I'm like, okay, well, how much mileage? And like, I just want to do about 3 miles a week, 3 times a week. 3 miles a week, sorry, 3 miles a day, 3 times per week. And I'm like, well, why is running so important to you? And they're like, well, it's my stress relief. And I'm like, okay. Do you have you have a stressful job? Is it a stressful home situation? And like, yeah, it's just a little bit stressful with COVID and then also with my work and how things are changing there and not being able to get out as much, and started affecting my life with my kids and my husband. And so you see how we got into more of like their deeper why, because if you guys can tap into what your why is, you're going to be much more compliant with exercise I'm going to give you, and you're going to be just adhere to things that's going to improve your guys' outcomes with the tools that I give you guys today. You guys want to only go and get stuff and you don't feel like doing these exercises or have the drive to be able to get back to running, I want you guys to reflect back on what your why is. Okay, it's going to make everything a lot more easy. Okay, so that's the main things. I want you guys to write those down and also type them in chat. All right, so I see a comment here. I'm a beginning runner, currently running about 10 miles a week since COVID, looking to learn best practices as I grow and increase mileage. Awesome, awesome. Yeah, so that's another thing too, is I'm gonna be giving you guys, as we go along in this workshop, I'll be also showing you guys, you know, why do injuries happen? And it's actually due to people not ramping up or that are just starting running and they're not ramping up appropriately, okay? And so I'm gonna give you guys some guidance with that as well today. So absolutely. It's good to know. And then anybody else, go ahead and put in the comments what you are planning to or wanting to learn today. And then also kind of the things that we just covered, go ahead and put those in the chat as well. Okay. And this is all private. I'm not going to be, I am recording this workshop, but nobody's names will be reflected in this or anything like that. After the workshop, if you guys want to take like notes or anything like that, I'll be sending out the recording to your guys' email following this as well. So you guys don't have to memorize the exercise or anything that we go over. All right. Oops, light just turned out on me. All right. So let's go ahead and we'll get kind of started and dive deep into this. So before we kind of dive into that a little bit more, I want to talk a bit more about my practice and who I am as well. Like, you know, why should you guys be listening to me? Right. So my specialty is really helping runners get back to running and exercising while avoiding taking time off, injections, pain, and avoiding pain medications or surgery. Okay. All right. Not trying to brag, but I like to let my results speak for themselves. We have there's me, Dr. Nima, and Dr. Colin. We have over 100 5-star reviews on Yelp and Google. So I let the results speak for themselves. All right. And who we really specialize in working with is people that are active, whether that's running, people that are trying to get back into strength training, trying to get back into working out, or just being people that enjoy being active and have an active lifestyle. Okay. But our real niche, if we had to really niche down, it's runners. Okay. And that's who we enjoy working with most as well. Okay. All right. So main thing is I want you guys to know, number one thing I want you guys to know that there is a solution to your problems, okay, with running. And we've helped hundreds of people get back to running after sustaining an injury or dealing with chronic issues as well as acute issues. And we'll be sharing kind of the knowledge that you guys need to be able to accomplish the same thing as well, okay, and get back to running. All right, Stephanie says, I would like to get back to marathon training and learn some stretches I can do to help with the pain I'm feeling and my hip down to my knee. Absolutely, Stephanie. So this is a common injury as well. A lot of times their knee pain is also correlated to the hip, and we have a little bit, and most likely it's due to IT band tightness, and we'll be going more in depth with that in just a second too. Okay, so thanks, Stephanie. That's awesome. All right, so main objectives for today. I want to fill out and address the worksheet, okay? And then also there's a checklist on there. Okay? I also want to touch on all those different points as well, okay? Also want to talk about running injuries and why they happen. We're also going to be going over biomechanical, some biomechanical self-assessments, so you guys can start kind of figuring out what's going on with your bodies and where is the breakdown happening. And most of the time, it's not actually where you think. Okay, and then also go over runners' corrective exercises to start addressing some of these deficits that we're seeing through these self-assessments. And I also want to share success stories of people just like you that have gotten great results, because I think that's super important. A lot of it is sometimes people just I hear it all the time is, oh, I'd love to get back to doing a half marathon, but I haven't done a half marathon in over 5 years because of the pain. And I just don't know if I'll be able to get back to that. And so if I could just run a mile or two a day, 3 times a week, I'd be happy. Okay, that's great. But there's no reason that you can't get back to doing a half marathon. And we've helped tons of people do that and get to high levels of running pain-free too. So next thing is also go over some myth busting. There's a lot of myths out there regarding running and some false narratives out there too. So I want to be addressing that and what the research is showing there. And then I want you guys to stick around for the entire workshop. All right, because at the end, there's gonna be a bonus. There's gonna be a special offer at the end as well. Okay, guys? All right, so why so many injuries? Why are running injuries so prevalent? And it's up to 70% of recreational or competitive runners sustain overuse injuries during any 12-month period, right? That's crazy. That is just astronomical. Why is that? And it's due to one big piece is that when we run, we land with 3 to 5 times your body weight. And if we don't have the strength or capacity to absorb that contact, then things start breaking down. So for example, usually the first thing that starts breaking down is the knee at 42% of running injuries, foot and ankle at 17%, lower legs like shin splints and stuff like that, 13%, and then hip and pelvis at 11%. And there's a couple other smaller injuries, like we just had somebody come in that is having shoulder pain with running. That's a little bit more rare, but there's some other running injuries at other different body parts that are just kind of sprinkled in there to make up that 100%. But number one thing we see is knee issues, followed closely by foot, ankle, and lower leg, and then hip and pelvis. All right. So if you guys are dealing with stuff like that, you're not alone. Okay. All right. So predictors of injury. All right. History of injury is a big predictor. So for example, if you've had a knee injury in the past, you're already automatically at an increased risk for injury right off the bat. Okay. But are you doomed? No, you can't. It is a predictor, but it's not necessarily mean you will have an injury. It just means you have to be that much more diligent and bulletproof your body as well, which we'll be discussing. Okay. Weekly mileage and then patterns of increase. Okay. So I think we had a comment earlier here that somebody was wanting to kind of learn how to ramp. They're new to running and they want to ramp up their mileage in a safe way. So this is it's super important because this is a big predictor of injury. If we ramp up too quickly, it puts us at increased risk. Okay. Then lower extremity movement patterns. This is just a fancy term, is how well do you control your knee, ankle, and hip when we're landing with 3 to 5 times your body weight with each step. And we're gonna be going over some assessments for you guys to figure out just what those movement patterns, if your movement patterns are good or if there's some deficits there as well, okay? And then impact forces. Are we doing a heel strike or are we landing with our forefoot? So that can change off on how much we're landing and how much force we're landing, and then also on how much we're kind of propelling ourselves upwards, okay, versus horizontal. We don't want to get a whole lot of up and down because that's wasted energy. When we're running, we're trying to land or run this direction, right? We don't, any energy that goes this way is wasted energy. And also the higher we kind of jump up, okay, when we run, the more force that we're landing with as well. So it makes a difference, not with only decreasing risk for injury, but also it improves your performance as well because you're not having so much wasted energy, okay? And then heel strike versus forefoot, we're gonna be getting into that a little bit later. Main thing is if you land with your heel, there's not a lot of shock absorption. It goes straight to the bone, right? And then it gets transmitted up into the shins as well as the knee, and then we can start seeing breakdowns. However, if we land with more weight on our forefoot, then we can get some of the calf muscle to help provide some of the impact forces and decreasing those, okay? And then another thing is body mass index. So if we're landing with 3 to 5 times our body weight, so if we're carrying around a little bit of extra body weight, that means we have to land with that as well. So higher body mass index also puts people at a higher risk for injury. Does all this stuff mean that, oh, if you aren't doing all these things, you're definitely gonna have an injury? No, does not necessarily mean that. It just puts you at a higher risk for injury, guys, okay? So I'm not gonna go super in depth about the anatomy, okay? But we have I think the better understanding that you guys have of the anatomy, you're gonna be better able to understand why we're doing the exercises that we're doing. Okay, so for example, we have the femur, okay, that's the large thigh bone, and we also have the patella, which is a kneecap, okay? And that kneecap has to be able to move back and forth freely. If we have a tight quad, a quadricep muscle, or tight IT bands, it can throw off the tracking of that kneecap and can cause some grinding and irritation underneath that kneecap and cause some pain there. I suspect that's something that Stephanie is dealing with a little bit as well, due to the pain in the knee as well as the hip, because that IT band attaches down at that kneecap and can pull it off to the side. All right, and that IT band, it just kind of runs alongside of the thigh. All right, and then we also have our tibia, our fibula. This is kind of like our shin bones, okay, where we can get some shin splints. And then we also have the meniscus. The meniscus is in the knee, and it's kind of like a shock absorber in the knee, and we can get some tearing and degeneration there as well, and can be a result or cause some injuries as well. Okay. Then we also have the Achilles. Okay, the Achilles is right above the heel. It attaches into the calf muscles, and this is something that can be irritated as well with running. And then plantar fascia, that's kind of like on the bottom of your foot. And so if you're having pain at the bottom of your foot, especially when you get out of bed in the morning, that's most likely plantar fasciitis, okay? And then we also have the hip, we have the glutes, and then we also talked a bit about the IT band. The glutes are just kind of the big butt muscles, and those are responsible for helping the alignment down the chain with regards to what the knee and the hip is doing and how well you control the absorption there when you're landing. And we'll be talking about that, the importance of glute strength in just a second, okay? So let's go ahead and discuss the types of injuries. Obviously, there's tons of different types of running injuries, but these 5 that I'm gonna be touching on are gonna cover large majority of what you guys are dealing with, okay, most likely, okay? So patellofemoral pain. We've already talked about how that kneecap, this essentially means that kneecap isn't tracking properly as we bend and straighten our knee and while we're running, and it can cause some irritation under that kneecap and near that IT band, okay? And then we also have IT band syndrome. So the IT band, again, is on the outside of that, that thigh muscle. And what can happen is if our glutes aren't strong enough, that knee is gonna actually cave in when we run. And because that IT band runs alongside on the outside of the thigh, every time our knee collapses in, it stretches that IT band, repeatedly, and it becomes irritated, inflamed, and we can start getting some tightness as well as pain there as well. Okay. Then also shin splints. This is usually due to can be due to poor running mechanics or landing doing a heel strike and landing with a lot of force. And then also increasing mileage substantially pretty quickly can also cause shin splints as well. Okay. And then Achilles tendonitis. This is just overuse of the calf muscles and can be due to poor running mechanics as well. And then plantar fasciitis. And this can be caused due to poor ankle mobility. And the Achilles tendonitis and plantar fasciitis can be caused by poor ankle mobility. And we're actually be assessing everybody's ankle mobility today. I'm gonna be giving you guys some self-assessments to see if that's playing a factor into your guys's pain or discomfort that you guys are having. All right, so let's get into some of the assessments. All right, get you guys moving a little bit. So you guys don't have to listen to me jibber jabber up here, okay, for the entire time. So let's go ahead. I want to first look at your guys' ankle mobility, okay? So what I want to do is I'm going to actually stop sharing my screen so you guys can see my full screen here a little bit better, okay? So what I'm going to do is I want you guys to find a wall, okay? And what you're going to do is you're going to come up to that wall. You're going to take your foot, bring it up to that wall, okay? And then we're going to try and touch our knee to the wall, okay? Everybody should be able to do that. What we're going to do next is we're going to bring our foot back about an inch and do the same thing and keep retesting until we can't go back any further. I'm actually going to move this down a little bit so you guys can move this. Don't mean to make you guys dizzy, but so you guys can see a little bit better here. We're going to go inch by inch back, okay? Foot up, and then an inch back, and forward, inch back, okay? And until you start feeling that heel lift up. Do you guys see how my heel's starting to lift up now? So my limit's about 4.5 inches away from that wall, okay? Then you guys want to also test the other side, okay? Inch by inch to see if there's any asymmetries. And so you guys can see my heel starting to lift up again. So I'm pretty symmetrical. So I've got about 4.5 inches away from that wall on each side. Okay, I'm gonna be going over the norms in just a second. I don't want anybody cheating. So what I wanna do is kind of discuss why this is so important. Okay, so when we run, our shin, we have our foot here. Our shin has to, when we bend, okay, and go to push off our foot, we have to have good ankle mobility. If we don't have that, then we start seeing compensations in the knee as well as the hip, and that's where we start getting some breakdowns, okay? Let's see here. All right. So while you guys are doing that, let's see here. I'm gonna go kind of over the norms here and pull these up. So the norms is for a normal walking pattern, we ideally need 3 inches away from that wall, okay? If we don't have that, we're gonna start seeing some breakdowns, okay? With just our normal walking pattern. However, for running, as well as if we're doing like a deep squat or anything like that, we need to have ideally 4 to 5 inches away from that wall for normal walking, or for normal running mechanics. If we don't have that, we're going to start seeing some discrepancies there. So for example, we might start when we run, we might actually, to make up for that poor ankle mobility, we might actually have to toe our feet out, okay, when we're running a little bit more than we normally would, okay? And ideally, we need to have our feet pointing straight ahead. But if we don't have good ankle mobility, we'll start seeing some toe out. And then also we can get a little bit of what we call a heel whip, okay? So to clear the ground, we start kind of actually, you guys have probably seen that. If you guys have been running behind somebody, you'll see sometimes people will I'm exaggerating it, but when they run, they'll kind of do the heel whip. And that can be most likely due to poor ankle mobility, okay? All right, so let's see here. Viva says, I used to be able to run 6 miles. I slacked off and trying to get back to running. I was training for a half marathon so far. So far, I'm only able to run 3 miles. Is that due to knee pain? Is that due to, kind of fill me on what the injury is or where you're having that pain? But yeah, this is super common where people are trying to gear up for a half marathon or a marathon, and it's just due to the ramping up process. It can be too much on the body. All right, let's see here. I'm gonna go back to my slides. Felicia says, that sounds like me. So you guys can see a lot. I don't want to like put runners in a box, so I'm a runner myself, but a lot of times everybody's dealing with a very, very similar injury. Okay, all right, and having a very similar situation. Okay, so let's go back. So any questions on that assessment, guys? Okay, if you are seeing some limitations and you're not able to get that 4 or 5 inches away from that wall, that means we need to start working on your ankle mobility through calf stretching, calf foam rolling, stuff like that. And we're gonna be going over some stuff to address that as well, okay? All right, so now we also wanna look at foot control, okay? How well do you guys do with that? So what I want you guys to do is go ahead and slip your shoes off and then find a flat surface. Let me go here. So what I want you guys to do, I'm gonna keep my shoes on here for this, but what I want you guys to do is stand actually on one leg, okay? All right, so stand on one leg. And I also want you guys to see how well your foot is stabilizing too, okay? So what you're gonna do is you're gonna stand on one leg, bend the knee slightly, okay? All right, and see how stable you are. Do you feel like your knee's wobbling a lot? Do you feel like that foot is collapsing in? Okay, now what I want you, if you guys are doing okay with that, now what I want you to do is go ahead and close your eyes, okay? It's gonna be much more difficult. See if you guys are able to do that. Do you lose your balance? Do you feel your knee or ankle become more wobbly? If you do, that kind of gives me an indication that there's something going on with the foot strength, okay? And being able to stabilize that, because if our foot's not stable, that's going to work its way up the chain into the knee as well as the hip. Okay, we need to have the feet very strong. Okay, so I want you guys to try and ideally hold for 30 seconds on each leg with eyes closed, and then also do another 30 seconds on the other side as well. Okay, how did everybody do with that? Was everybody able to do that, or do you guys have any difficulty? I'm gonna pull up while you guys are doing that. I'm gonna get set up for the next test. Any pain with that, guys? Sometimes that test can elicit some discomfort or pain. All right, so Goldberg says that left foot was more stable. Yeah, so you guys will notice that. You guys will realize that, find some stuff that you guys didn't know about your guys' bodies and where your strengths and weaknesses might be, okay? Okay. All right, so let's go ahead, and what we're gonna do next is go ahead and look at your guys' knee control. Okay, this is, in my opinion, this is one of the most important tests. When the runner comes in to see us, we go through about 15 orthopedic tests and measurements. Okay, and the four that we're covering today are included in those orthopedic tests. There's a couple other higher level ones, but these four that I'm giving you are ones that are easy to see the deficits, and you don't necessarily have to have an eye or an act for it. Okay, so that gives you guys good insight on if the foot strength is an issue, okay, and how well your foot's controlling things. So what you guys do next is grab a chair, okay, or something that's stable. Stephanie says, I definitely noticed I was more stable on my left as well, even though I'm typically right side dominant. Okay, that's interesting too, okay? A lot of times that we see is patients will work on, like, before they come and see us, or once they're seeing it, done seeing us, they're like, oh, now my bad side is the good side, right? And it's because they've been working on it for so much that we actually start getting some asymmetries. And that's why it's important, the exercise I give you guys today is to make sure that you're doing each side equally, even if one side's worse than the other, because what's going to happen, you're going to play a catch-up game, okay? Where one gets better because you've been working on it, and another one's lagging, and then you make that one better, right? And it's just a catch-up game. Make sure that you're doing equally, and then eventually they'll catch up to each other and be at that same point as well, okay? So what I want you guys to do is, yeah, grab a stable chair, okay, or something that you can sit on that's stable, okay? And what you're going to do is you're going to actually stand on one leg again, okay? The reason so many tests that we're doing are single leg is because guess what? When we're running, we're always on one leg. We're never in a double limb stance, okay? So what you're gonna do is you're gonna stand on one leg, okay? Make sure that chair's right behind you. And what you're gonna do is you're going to sit down, okay? And then stand back up. What I want you guys to be looking for is how stable that knee is. Do you guys see that when you do this? Do you see that if the knee collapses in, okay? If you do this and your knee collapses in like that, that tells me that the knee control isn't that great, okay? And that's due to either weakness at the foot or weakness in the glutes, okay? And that can cause some knee issues as well, okay, guys? So let's do a couple reps there. This is what it should look like, okay? See how my knee's staying out? Down, nice and slow and controlled. We don't want to like plop. We don't want to be like this, right? We want to be nice and slow and controlled all the way down. And that chair should be about 90 degrees, just a little bit higher, okay? We want that knee to have good control, all right? And then we're gonna switch and do the same exact thing on the other side, okay? See if is it easier to get up on one side versus the other? Okay, that's something that can give you a good insight as well to the strength of left versus right. And then if you guys have any pain with that too, this is also a good indicator of injury. Okay, so like for example, if it was hard, like if you're having pain on that left side and you had a hard time getting up on that left side versus the right, it's most likely weakness is definitely playing a factor into the injury or discomfort that you guys are having. Okay. All right, any questions on that one? But that's a super important test, guys. Okay, that tells us a lot just based on, because if we're just stabilizing our body weight there. Okay, when we're running, we're landing with 3 to 5 times our body weight. Okay, and if we're not able to control it with just our normal body weight, then we know that most likely that knee is not being stabilized when we're running and landing with 3 to 5 times our body weight. Okay, hopefully that makes sense, guys. And again, if some of the stuff doesn't make sense, go and put in the comments. Okay, it's just because I didn't do a good enough job of explaining things. Okay. All right. So final test here. Okay, so we're gonna also look at your guys' muscular endurance and control and do the single leg hop test. Okay. So what I want you guys to do is you're going to stand on one leg, move this box out of the way here. Okay, and what you're gonna do is you're just going to hop from side to side. Okay, do you guys have any pain with any of that? Okay, and then you wanna go side to side. Okay, we're gonna do about 10 hops each side. Okay, and when you're done with that, I also want you guys to do forward and back, 10 taps. Okay, and then do the same thing on the other side. So this is also looking at, yeah, our muscular endurance as well as our control. Now, because we're hopping and jumping, we're landing with a little bit more than just our body weight, and starting to replicate running. And if you're having some pain with that, most likely you're gonna be having some pain with running as well. And it's a good indicator on if you're at the point, if somebody's been resting for a while and they're trying to decide if they should be able to get back into running or not, that test is a great thing to do to start seeing what the capacity is. Okay. Did anybody have any pain with that or discomfort, or notice that it was kind of harder to balance maybe on one side versus the other? All right, what I'm gonna do next is I'm gonna start sharing my screen with you guys. So Stephanie says, I felt a bit of discomfort at my right hip. Okay, so that does add up because it does require a lot of knee control, and we're suspecting that Stephanie's got some IT band pain that's going on as well. Okay. So it just means that that hip isn't controlling that knee the way that it's supposed to. Right. Okay, guys, what I'm gonna do is I'm gonna share my screen. See you guys again here. Okay, any questions on those tests, guys, at all? Okay, it's super, super important to be assessing and not guessing. This is where we see a lot of people start, especially if they're self-treating, this is where they go wrong, is that they're having knee pain. So what most people do, they go on YouTube and they search best exercise for knee pain for runners or something like that, or best exercise for knee pain, how to decrease knee pain. And the thing is, the knee isn't the issue. Even though that's where the pain is, that doesn't necessarily mean that that's where the issue is. For example, as you guys know now, if we have poor glute strength or hip strength, that's going to start changing the trajectory and alignment of that knee when we're running, right? So it's actually the hip that's the issue, not the knee. Okay. So this is, I'm going to kind of go through like what treatment should look like, okay, and how you guys should kind of take yourselves through this. Okay, so how we do things and how the exercise that I'm going to be giving you guys is going to be start addressing this first step, okay, to start getting you guys some symptom relief and pain relief, okay, and decreasing that. So we have a 3-step process for runners and the patients that we see. So first thing that we want to do is obviously decrease the pain and symptoms that the person or the runner might be experiencing, okay? But that's not what our main goal is, okay? I get this question a lot from my patients. Do I need to keep doing these exercises the rest of my life? Well, it depends on what phase of this stage of treatment that you're at. If you just use exercises to decrease pain and symptoms and being reactive, then yes, you're gonna have to keep doing these exercises throughout the rest of your life until you address that root issue, okay? And that's where the second step is so important. After we start getting symptom and pain relief, we need to find and treat the root issue, okay? So, for example, we need to figure out if somebody's having, for example, Stephanie was talking about how she's having some of the IT band symptoms and pain. So if all we did, we can go over some stretches on how to loosen up the IT band, loosen up the quad, foam roll it, stretch it, and it's gonna make it feel a lot better. But the minute that she goes back to running and has that knee collapsing in because of poor hip control, that IT band is just gonna become irritated again, and then they're gonna have to do the stretching and do the foam rolling as well, just to decrease that pain from the increase in tightness and irritation from the running. However, if we treat the root issue of, let's say, her hip strength and her glute strength isn't where it needs to be, then we don't have to be so reactive. We don't need to be doing so much foam rolling for the IT band and so much stretching for the IT band because it's not irritated, because our knee control is where it needs to be. Now that IT band's not getting irritated, right? So now we don't have to address it because it's not an issue, okay? Because we hit the root problem of everything, okay? And then third step is become a bulletproof runner, right? Although the issue that somebody might have initially came in for with regards to like the IT band pain, even though that's taken care of, we want to make sure that also no other injuries aren't going to pop up as well. So for example, if somebody comes in for knee pain, I don't want them to, no offense guys, but if somebody comes in treatment with us, no offense, but I don't want to see you guys again in the clinic, okay? And so the big piece of that is looking up and down the chain, looking at the knees, the ankles, the hips, the low back, even the shoulders, and looking at the efficiency and making sure that the running mechanics are good, and the rest of the body, there's no asymmetries or issues there as well. So that's kind of the 3-step process that you guys want to go through, okay? And today we're going to be hitting that first phase to start getting you guys some to decrease some of the pain and symptoms that you might be experiencing. All right, so let's get into some of the exercises. Okay, so we talked about a little bit about how the IT band and the quad goes down and attaches at that kneecap and can cause the kneecap to track improperly. And I suspect that's what a lot of people are dealing with, because this is the number one thing that we see with runners is knee pain due to quad and hip flexor tightness. Quads and hip flexors get tight very quickly, especially if we're sitting quite a bit throughout the day. I know a lot of people are working from home now and don't have the correct ergonomic setups, or they don't have their standing desks like they normally would at work. So the quads and the hip flexors are getting tight. So I want to start addressing that right away, guys. Okay. So I'm going to stop sharing my screen so you guys can see me demonstrate these exercises. Okay. So again, I want you guys, if you guys have a yoga mat, go ahead and grab it. That would be awesome. And then also, if you guys could grab a foam roller as well. If you don't have one, that's okay. And you guys also don't have to be memorizing these exercises at all either. After the workshop's over with, you're going to get a link to our YouTube video on each of these stretches, taking you guys through these on how to do them properly. Okay. So, but if you have questions, let me know. Okay. So what you're going to do is you're going to get in a half kneeling position. I'm going to turn around here. I use the foam roller just for balance. Okay. So you're going to do is you're going to have one knee down, the other leg kind of at a 90-degree position. And what you're gonna do is you're gonna squeeze. So I've got my right knee down. I'm gonna be squeezing my right glute, okay, pulling that rib cage down, and then I'm shifting my hips forward. Should feel a nice stretch in the front of the hip here, okay? And some people, if the quad's really tight, you may feel a little bit lower, okay? And ideally, you'd be holding this for about 30 seconds. Make sure you have something underneath your knee. So if you're already having knee pain, it can be sometimes painful to kneel down on like a hard floor. So using like a pillow or something soft can help decrease that. Okay. See a lot of people where they don't contract their glute or don't contract their core, and they're kind of just like leaning in like this, like, I don't feel anything. Well, it's because you're not anchoring the tissues down. So make sure you're squeezing that glute, pulling the rib cage down, and then shifting your hips forward. It's going to make that stretch much more intense. Okay. So about 30 seconds there. Ideally, you'd be doing 3 sets. Just for time purposes, so we can make sure we get through as many exercises as possible. We're just gonna be doing 1 set. All right, next thing we're gonna do is switch and do the same thing other side. Okay, so left knee's down now, squeezing the left glute, pulling the rib cage down, shifting the hips forward. Should be feeling a nice stretch here and maybe a little bit up here as well. Just depends on where everybody's gonna be a little bit different just based on tightness. Okay, so again, about 30 seconds here. All right, while you guys are doing that, I'm gonna get set up for the next one here. So the next exercise we're gonna do is we're actually gonna be going after the quad a little bit more. This one that we're doing now was going after the hip flexor a little bit more, which can get, yeah, pretty tight from sitting for a long period of time. Next one we're gonna do is going strictly more after that quad. So this is called the couch stretch, okay? So you can do, actually this is a little bit high, but we'll make it work, okay? So what you're gonna do is you're gonna rest this back leg up on something, be like a couch, hence the name, the couch stretch, all right? So knee's gonna be bent. This is gonna put more tension on that quad, okay? You're gonna feel the stretch a little bit lower, okay? Again, squeeze that right glute, pull the rib cage down, chest up, we're leaning forward. Should feel a nice stretch down here. So if you're also this is gonna help Stephanie or anybody else that's having IT band issues as well. So the IT band is over here and kind of comes over a little bit to the front near the quads, and it's gonna help, there's fascia that encapsulates the muscles. Okay? It's thin connective tissue that goes around the IT band, goes around the quads, goes around all muscles, all right? And so if the quad is tight, a lot of times that fascia that's over the top of it is tight as well. And because that fascia overlaps both the quads as well as the IT band, by stretching out the quads, we can get some IT band relief as well. Okay, guys? Any questions on those two at all? Again, if you guys have any pain with these, stop. Okay, these should be all pain-free. This isn't a no pain, no gain type of thing. All right. Okay. So the best way to loosen up muscles is a combination of stretching as well as foam rolling. Okay. So if you guys have a foam roller, go ahead and grab it. If you don't, that's okay too. All right. The stretching is going to make a huge difference alone on its own. Okay. But for those that do have a foam roller, or like a massage, some people have like massaging gun or anything like that. You also want to be rolling over the top of that quad as well. So what you can do, grab your yoga mat and your foam roller, All right. So I see a lot of people that foam roll the quad incorrectly. Well, I guess not incorrectly, they're just not maximizing it as much as they could be. So that quad muscle is a very large muscle. It wraps all the way around from the front or the side, all the way to the inside of that leg. Let me tilt this down a little bit so you guys can see a little better. So we want to make sure that we're not, I see a lot of people, they just foam roll the very front part of the quad. So what you're going to do is you're going to be on your elbows like this. Okay, you can start out with both legs on the foam roller. And what you're going to do is you're going to roll up and down the entirety of that quad like this. Don't be rolling on the kneecap. Then you guys can also, to hit the inside of the quad, you can point your toes out, point your toes in to hit the outer part. Okay, and then you can point the toes straight down to hit dead center. If you first find like there's a real tender spot or there's a knot, what you can do is you can pause down on that knot, okay, and bend that knee and straighten it. This can be pretty intense. Okay, so what we're doing is by bending that knee, we're shortening and lengthening that muscle, and it's actually pulling that knot over the top of that foam roller to help break up that tissue. Okay. So a lot of times, if anybody's having knee pain, as we mentioned earlier in the workshop, about 42% of running injuries are knee issues. By literally doing those 3 exercises that I gave you guys, it's going to help decrease your symptoms and your pain significantly. Okay, pretty much for almost any knee injury. Is it going to solve the root issue? No, but it's going to start giving you guys some pain relief right away. And this isn't just for knee pain with running; it's any knee pain in general. Okay, so ideally, you're doing 3 sets of 30 seconds, 2 times a day. Okay. Any questions on that one, guys? You guys do okay with that? All right. Okay. I don't see any questions coming in. So what we're gonna do is we're gonna move on to to start addressing the ankle mobility. Okay. So what I want you guys to do is, well, first of all, I want to go back. Do you guys remember your guys' results from the ankle? Was anybody less than 3 inches away from that wall? Or kind of type in if anybody's having restrictions with that. So usually when I do these workshops, we've been doing a lot of them before COVID in person. And so I was able to go around and see everybody's ankle mobility, but now it's hard because I can't see everybody. So I have to rely on you guys typing things in here, okay? But usually when I do these workshops, thing that most people have tightness with or restrictions at is the quad and the IT band, and then also ankle mobility. So I'm gonna be kind of tailoring it to that and what we found to be most restricted for past workshops as well, all right? So what I want you guys to do is we're gonna start making improvements on the ankle mobility because it's so imperative for runners to have that ankle mobility, and can also start decreasing any pain that somebody's having in their ankle or their knee, okay? Like I said, if we don't have the ankle mobility, we start seeing compensations at the knee joint as well as a little bit into the hip, okay? So even though somebody might not be having pain directly in the ankle, the reason they're having pain, the root cause might actually be their ankle mobility, okay? All right, so what you guys to do, we're gonna start making some progress on that. What we're gonna do is, actually move this back a little bit further. So there's 2 calf muscles. There's the gastroc and the soleus. Okay, the gastroc attaches above the knee, the soleus attaches below the knee. So we can bias which one we're stretching, whether that knee is bent or if it's straight. Okay, this is why I see a lot of people make mistakes. Is they're like, I'm trying to work on my ankle mobility, work on my the tightness in my calves, and it just doesn't seem to be getting much better. And I asked them to show me what stretches they're doing, and guess what? They're only doing a stretch that's either targeting the gastroc or the soleus. Very rarely is everybody doing both of these stretches simultaneously. And this is where a lot of people go wrong. And these 2 exercises are going to help really unlock that ankle joint. Okay. So what you're going to do is you're going to find a wall, place that back leg straight. Don't have the toes pointed out. We want the toes pointed straight ahead. Doesn't matter a whole lot what this front leg is doing, just as long as it's stabilizing you. Okay, and what you're gonna do from there is you're going to be pushing into the wall. Okay, and you should feel a nice stretch in this calf muscle. Okay, keep that heel on the ground. You're gonna be pushing into that wall for about 30 seconds. Again, none of this should be painful. I also want you guys to make a note of the sensation that you're feeling as well. So we can compare to the other side to see if one side feels tighter when you're doing these stretches and see if it lines up with the assessment results. Okay, so go ahead and switch to the other side. Same exact thing. Back leg straight, doesn't matter a whole lot what this front leg is doing. We're trying to stretch this back leg. And should feel a nice stretch kind of in the top part of this calf. So we're going after the gastroc muscle with this. And this muscle comes down and attaches into the Achilles, and the Achilles attaches in the heel, ultimately limiting ankle range of motion. So gastroc tightness is also a result of, it can be a cause of Achilles tendonitis and ankle issues as well. All right, so now let's go up to the soleus. So this muscle attaches below the knee joint. We're gonna feel this a little bit lower, okay? Some might feel it actually in the heel, some might feel it up here, okay? So what you're gonna do next is you're gonna, instead of keeping this back leg straight, you're gonna start with that back leg straight, but then what you're gonna do is you're going to drive this knee down to the floor, okay? But still keep that heel down. Again, you should feel the stretch a little bit lower in that ankle or in the calf muscle. All right, and then same thing other side. And again, make note on if you feel any imbalances between left and right. Okay, any questions on that one at all? Okay, no questions so far. All right, so what I want to do next is, like I mentioned earlier, for loosening up any muscle, like when we talk about the quad, the best way to loosen up any muscle is a combination of stretching as well as foam rolling. So we got 2 good stretches for the calf muscles. Okay, both of those calf muscles, 2 good stretches. Now we want to also use the foam roller, okay, to help loosen up tissues as well. When we're doing foam rolling, I forgot to mention with the quad, we should be foam rolling for about 2 minutes. This is where I see a lot of people make mistake too, is they like foam roll for like 10 to 20 minutes, and it actually can make things a little more irritated and can cause some inflammation and pain as well. So 2 minutes is max. Sometimes less is more. In this case, it definitely is. Okay. So again, grab your guys' yoga mat as well as a foam roller. Same thing with the quad. That calf muscle wraps all the way around from here all the way to the other side. So I see a lot of people just hit the middle part of the calf and they neglect the outer part as well as the inner part, just like they neglect the quad muscle as well. So how do we make sure we're hitting the entirety of the calf? Keep the toes pointing straight up and rolling back and forth all the way up and down the lower leg, and then also pointing the toes out. Point the toes out, and it's going to hit the outer part of the calf. A lot of times this is even more intense than the other way. A lot of times the outer part of the calf is where a lot of the tightness is stored. Okay, then we can also point our toes in and foam roll here, like this. Okay, and what you can do too is if you find like a tight spot, so like right now I've got a pretty gnarly knot on my right ankle, or sorry, my right calf. What I'm gonna do is I'm gonna pin down on that, stop moving, and I'm gonna bring my foot up, then point it down. Point it up, point it down. I'm gonna do about 10 repetitions there. Okay, that can help to break up some of the tissues and the tight tissues, just like we did with that technique for the quadricep muscle. All right, any questions on any of those at all, guys? Right. I'm gonna go back to my slides here so we can kind of recap these exercises. Okay, so The runner's corrective exercise that we went over was the half kneeling hip flexor and quad stretch, or the couch stretch. Then we also went over the quad release with the foam roller. Okay. We also went over the soleus and gastroc stretches, and then also the calf release. These main things are unlocking the knees as well as the ankles, which is going to make big changes up the chain. So I know we didn't go over any hip exercises, because you guys know during that, that's like number 3 or number 4. It's actually number 4 on the frequency of injuries. But the ankle, and releasing the ankle is releasing the quad, and the knee joint is going to help that hip joint as well if you're experiencing hip pain with this, especially because the IT band goes up and attaches at the hip, which we addressed. Okay, so let's go. Any questions over that at all, guys? Let's see here. Let me share my screen, make sure I'm sharing it. All right, so let's go over some myth busting. So heel striking will cause injury. Not necessarily. Does it put you at higher risk for injury? Yes, but will it necessarily cause it? No. So heel striking is where we are landing with our heel, okay, versus landing more on our forefoot, okay? So a lot of times I'll ask people, are you a heel striker or do you run on your forefoot? And a lot of times I get, well, I'm not sure. When people say they're not sure, 9 times out of 10, they're actually doing heel strike. It's going to feel weird to run on your forefoot. You want to make sure that you're not putting cold turkey with the heel striking. You want to find what makes sense for you and what feels comfortable for your body. But if you're dealing with an injury, and some of those times it can be due to heel striking. Okay. Another thing, myth is running is bad on the knees. Not necessarily. No, it's just that the body's capacity isn't there to be able to withstand landing with 3 to 5 times our body weight, right? So for example, swim, I took somebody that was completely sedentary, didn't exercise at all, and was really out of shape, and I had them go swim for an hour, would that be hard on their body? Yes. Isn't necessarily bad for their body? No, it just means that they just didn't have the capacity. They started at such a lower level. It was just too much dosage of exercise. They're going to be probably really, really sore, and probably maybe even sustain injury because of the lack of ramping up. Same thing with running. Running isn't necessarily bad on the knees. It just means that for running, it's a higher level exercise, and there's a lot of compression. We're landing with a lot of 3 to 5 times our body weight. We just need to be able to be strong enough to be able to withstand that. If we are able to withstand that, it's not bad on the knees at all. It's actually great. It can help strengthen up the joints of the ankles, knees, and hips, and help actually improve bone density and improve people's overall health. So no, it is not bad on the knees. It's just, it can be bad on the knees if somebody doesn't have the capacity, but for that landing. But that goes with any exercise, not just running, okay? Another myth is that there's a perfect running shoe. No, there is no perfect running shoe, okay? Everybody's foot and skeletal system is all a little bit different. Main thing is, if you have a shoe that you're running in and it feels great and you don't have any injuries, you found a great shoe. There's no reason to change it up or anything like that, okay? And then also barefoot running. I get a question about this. Should I be doing barefoot running or should I be running in shoes? It all depends. So should you just go from cold turkey, from not doing any barefoot running to all barefoot running? No, you're gonna start having some breakdowns because shoes do provide support. And if we don't have that support and we put too much increased load on our feet to start providing that stability, we're gonna start seeing some breakdowns. We need to start weaning people off of shoes if they wanna go to barefoot. You just don't wanna switch completely to barefoot running. Is there one that's better than another, like barefoot running versus shoe running? No, it's just based on personal preference, okay? Barefoot running does require, and it's gonna require a lot more foot strength, okay? And that takes time to build up and adapting, all right? I also hear this a lot, is stretching and foam rolling going to prevent injuries? No, it will not. It can help decrease the prevalence of them by keeping everything in proper alignment and having the proper ankle and knee and hip mobility. It can decrease it, but it's not gonna be the thing that treats the issue or the root issue. And I hear it all the time. People are just doing a lot of foam rolling and stretching to try and fix an injury. but really we talked about that 3-step process. All they're doing is just hammering that first step over and over again. They're not getting into that second step of treating the root issue, or step 3 of taking a full body approach and seeing where the breakdown's actually happening, okay? So it can help, but it's not gonna fully prevent. The thing that's gonna prevent it is eliminating asymmetries, improving strength and capacity, and figuring out how your body is responding to the running and all that too, okay? So I wanna share some stories with you guys, because I know it can be kind of scary to think that, and all of this, I'm gonna share 3 success stories with you guys, and all of them were ones that when I talked to them, actually I think 2 of them actually found me through a running workshop just like this. And I talked every time before I have somebody come in, I want to make sure we're a good fit for them, and that we can help them. So I'm not going to try and waste people's time before having them come in. And I sit down and I always discuss what their goals are, what they're frustrated by, what they've been struggling with. And 2 out of these 3 people, the ones that found me through the workshop, were so frustrated because they had been told by other people that they were never going to get back to running, that they were that they kind of just accepted that they weren't going to be able to run the way they wanted to again, okay? And so main thing is, by sharing these stories, I want to show you guys that it is possible to meet your goals, your running goals, and get back to running the way that you want to, okay? So this person went from, she went and saw her physician. She was having knee pain. She went and saw her physician, and her physician told her, assessed her knee and said, all right, she was wanting to do a triathlon, and she was training for it. And the physician told her, I just don't see that's how it's going to happen. You need to decrease your running or maybe stop running altogether. The physician gave this patient a knee brace and told her, all right, wear this, see how it goes, take some time off for running, and we'll see how it goes. And we'll check back in 6 months and see how things are going. And then the physician went on to say, if this doesn't seem to be treating or fixing things, or it's not feeling better, then we'll look into getting injections and then possibly surgery. Well, the patient, when she was with the physician, asked her, that's the physician, well, what about physical therapy, or is there any exercise I can do? And the physician's like, no, physical therapy is not really needed. Just go home and do some hip strength exercises, right? I'm like, you guys are like, probably like, what? Like, there's physicians out there like this? Maybe you guys have experienced something like this, but it's like, it just blows my mind whenever I hear a patient come in and tell me stories like this, that this is the result of the medical system, okay? So anyways, luckily, like, I give major props to this patient. She took it upon herself to go online and look for physical therapy, even though her physician told her like it wasn't needed. She knew that she was 26, and she was like, I'm not going to accept at 26 to not be able to run, right? What am I going to be like when I'm 50 or 60 if I'm already in this much pain and can't run? So she wanted to do physical therapy, and she found found us online, and she scheduled an evaluation. And I think if within, if I remember correctly, 2 sessions, she was completely pain-free. Okay. Was she back to running completely the way that she wanted to? No, but she was running pain-free. We just started off really slowly and we ramped her up. But I think it was either 2 or 3 months after we started working together, she completed a triathlon pain-free. Completed it, no issues. I actually just checked in with her 2 months ago, and still no issues. Still running the way that she wants to, and stuff like that too. So yeah, that's a super powerful story that I hear it's all too common, and it's frustrating. That's kind of how the medical system is. But again, props to her, but for taking upon herself to find her own physical therapist and go out of her way to do that. Because a lot of people just take it word for word, verbatim for what their physician tells them, okay? So this is another patient. She was dealing with chronic reoccurring injuries, and now she's back to running consistently pain-free. So she was kind of in this cycle of, she was a really high mileage runner. I think she was running on average about 12 to 13 miles a day, okay, which is crazy. She was actually getting ready to train for the Olympic trials, but she kept having all these little injuries pop up, and it was actually due to a lack of her strength training program. When you're running 12 miles a day, 4 or 5 days a week, that your body needs to be pretty strong and resilient. And so we actually, she had these little injuries that were going on. We addressed those, but then the next thing was going over a great strength training program that she needed to be doing 3 to 4 times a week. That was geared towards her exact issues. And now she's doing great, training how she wants to and running pain free. So, but yeah, so this was also another patient. She was unable to run for over a year. Now she's running pain free, and this happened in just a few weeks. I think she was dealing with it for about a year. Yeah, she was dealing with this. She was having knee pain as well. Was dealing with it for about a year. She just was in this cycle of resting and this and then coming back to running, resting, going back to running, but really not doing anything in the meantime while she was resting. She just thought, oh, resting is going to make it better, and then she'd go back to running and it'd come back again. And that's because the root issue when she was resting, that she was actually just getting weaker. The muscles that were already weak, and the root issue was actually getting even worse because she was sedentary and not running anymore. And so she was just getting weaker. And that's why she kept having these issues when she started trying to get back into running. So we identified the root issue, did a running analysis, and found some faulty movement patterns there, and then strengthened up the issues and where her deficits were. And now she's running pain free. And I think it was, yeah, in just a few weeks, she was back to running pain free. So she was one that told me, she's like, I can't believe I put up with this for over a year when it was this easy of a solution. She's like, I'm literally back to running pain free in just a few weeks. Like, I should have just done this from the beginning, or I wish I would have found you from the beginning, because it would have just wiped away all this entire year of frustration, right? And it's super simple. Okay. So you can get these exact same results too, guys. All right. This isn't, again, these patients that I just shared the results were ones that were hesitant because they had been told by so many practitioners, physicians, other physical therapists even, that they just stop running. If it hurts to run, just stop doing it, right? And that's no way to live, in my opinion. Okay. Hopefully that all makes sense, and I hope that gives you guys some empowerment and show you that that you guys can get back to these things, okay, and get these results. All right. So this is the bonus I want to offer you guys. All right. So I want to give you guys the runner's injury and fitness assessment. You guys are probably wondering well, what does the runner's injury and fitness assessment entail? So we go over, when a patient comes in, we go over current health and previous injury analysis, right? The biggest predictor of injury is a previous injury. So we go over that and address that issue. And then a posture and runner's initial alignment evaluation, looking head to toe. How is that a foot alignment? How is that knee alignment? How is that hip alignment? And see if everything's working the way it should. Then also look at the mobility and do strength assessments of the knee, of the hip, of the ankle. Like, we've already done a few assessments, but there's a lot more higher level ones to really nail down what the root issue is here. And then we also go over running and video analysis, and where we film you and also look at where we're seeing some faulty movement patterns. Are we seeing like that knee cave in? Are we seeing the foot collapse? Are we having movement inefficiencies due to the gait mechanics or running mechanics up the chain? And then we also you guys get a report, doctor's report of findings of everything that we address. So normally this is $235, but because you guys came to the workshop, I want to give you guys this for only $49. So this is good for the next 24 hours. Okay. And so don't wait. I'm also going to limit this to only 5 people. I think there was 30 people that signed up for the workshop. We're limiting this to the first 5 people that take advantage of this. Okay. And I'll be dropping a link here in the comments, and in the email follow-up that you guys get, you'll be getting the link to claim that as well. So hope any questions on any of that, guys, at all. Okay. So I know what a lot of you guys might be thinking. I just don't know if this will work for me. I don't think physical therapy is what I need to solve my problems. And like I said, these were the exact same thoughts that each of these runners in the 3 previous stories had as well, because had gone to numerous other practitioners in the past with poor results. And so I'm just gonna let these stories, and then you guys can also do your due diligence. Look us up on Yelp, look us up on Google, and you guys see between Yelp and Google, we have over 100 5-star reviews, and I'm gonna let those speak for themselves. All right, there's a lot of other testimonials for runners than the ones I just shared here that you guys can read on as well. So A lot of questions, a lot of concerns I get too is I just don't have the time or money right now. And the main thing is usually with traditional physical therapy, I don't know if you guys have tried physical therapy in the past, but usually with traditional physical therapy, you'd usually go in like 2 or 3 times a week, spend maybe 15, 20 minutes with the actual physical therapist. With us, it's quite a bit different. Every session's one-on-one for the entire hour. You're never gonna be treated by aides or assistants or anything like that. We want you guys to be independent. We don't want you relying on acupuncturists, other physical therapists, your physician, chiropractors, or anything like that. We want to give you all the tools and education that you need without being reliant on us, and be able to make progress at home when it's convenient for you. So patients, yeah, just come in once a week, and over that week's time, you should have made progress. The next time you come in, we're leveling it up and giving you new exercise to work on. And typically patients and runners just like you only need 5 to 10 visits with us, and they're back to running pain-free and knowing that this issue is solved once and for all. And with regards to cost, we have plans in place that make it this affordable to literally anyone, as we don't want financials to get in the way of you getting back to running pain-free and enjoying the life that you guys want to have as well. And we'll go over that more on the phone call too, which I do before we actually get you scheduled to make sure I can help you again, because I'm not here to waste your guys' time. So main thing is when I turn this back to, how long are you guys willing to tolerate this? Because most likely it's not, I don't want to be the bearer of bad news, but most likely it's not going to go, the root issue isn't going to be solved or go away on its own. And I hear it from all the time from patients when they're done. I wish I wouldn't have waited so long to do this. I missed out on so much looking back, and never really truly realized how much pain I was in and how much it was affecting my running and how it was affecting my life as well. All right. So that's all I've got for you guys today. I hope you guys found this beneficial and helpful and whatnot too. So what I'm going to do is I'm going to actually drop the link on where you guys can claim that, claim the voucher for the discounted runners evaluation. So let's go here, pull that up. All right, I'm dropping this in the comments here, guys. And again, this will be also with, oops, I didn't send that. I'm gonna send that to everyone. So all you guys have to do is click on that link to claim that voucher. Fill that out within the next 24 hours, and that will be applied to the running assessment. And what I'll do is once you guys submit that, I'll be reaching out to you guys over the phone to learn a bit more about the pain and the injury that you're experiencing, and what your goals are. And if we're a good fit, then we'll have you come in for the assessment. Okay. So that's kind of what that looks like. All right. But yeah, any final questions at all, guys, before we hop off? But I hope the main thing I want you guys to know is that running injuries are totally fixable, and this isn't something you guys have to deal with or endure or anything like that too. All right. And then the email that I'll be sending out will have the exercise that we went over today. You guys can start on those right away. Okay. Start getting some relief. Okay. As well. And then if you guys have questions, what you can do is you can just hit reply on that email, or you can message me through our website. There'll be a link to that as well. Or you guys can search us on Google. Yeah. So, but yeah, hopefully that, again, this is helpful. Any other questions at all, guys? All right. Well, I hope you guys enjoy the rest of your what is it today? Wednesday, losing track of the days with COVID and all of this kind of blend together. So hope you guys enjoy the rest of your Wednesday and enjoy the rest of your week. And I'm here if you guys have any questions at all. All right. Thanks, guys.